Anorexia nervosa is an eating disorder, mental disorder. Look at these pictures: negative body imaging, restriction of food habits, detail going on. Introduction. Anorexia nervosa is a serious, potentially life-threatening eating disorder characterized by self-starvation and excessive weight loss. It affects people of all ages but is most common in adolescent females. The disorder is marked by an intense fear of gaining weight, distorted body image, and extreme dietary restrictions leading to severe malnutrition. Definition. Anorexia nervosa is a serious eating disorder characterized by extreme weight loss, intense fear of gaining weight, and a distorted body image leading to severe restriction of food intake. It can cause life-threatening complications including malnutrition, cardiovascular problems, and organ failure. Types. There are two main types. One, restricting type. Weight loss is achieved by dieting, fasting, or excessive exercise without regular binge eating or purging. Second type, binge eating, purging type, involves periods of binge eating followed by self-induced vomiting, misuse of laxatives, diuretics, or enemas. Causes. The exact cause of anorexia nervosa is unknown, but it is thought to result from a complex interplay of psychological, biological, and environmental factors. 1. Psychological factors. Perfectionism, obsessive compulsive traits, low self-esteem, and desire for control. 2. Biological factors, genetics and neurotransmitter imbalances such as serotonin dysregulation may predispose individuals. 3. Environmental factors, cultural pressures to be thin, social media influence, stress and family dynamics. Risk factors. 1. Genetics, a family history of eating disorders, depression, or substance abuse. 2. Psychological disorders, anxiety disorders, depression, or obsessive compulsive disorders. 3. Social factors, pressure from society, or peers to maintain a slim body. Participation in activities that emphasize appearance such as ballet, gymnastics, or modeling. For personal traits, perfectionism, high achieving personality, and a tendency towards obsessive compulsive behavior. Complications: 1. Cardiovascular problems, bradycardia, hypotension, arrhythmias, and risk of sudden death. 2. Gastrointestinal issues, severe constipation, bloating, and abdominal pain. 3. Endocrine problems, amenorrhea, absence of menstruation, infertility, and osteoporosis. 4. Malnutrition related issues, electrolyte imbalance, anemia, and organ failure. 5. Neurological problems, cognitive impairment, seizures, and peripheral neuropathy. Pathophysiology: anorexia nervosa involves multiple organ system and alerts the normal functioning of the body. The body's metabolism slows down due to starvation, resulting in the preservation of energy stores. Malnutrition affects the hypothalamic pituitary axis, leading to hormonal imbalances, including reduced thyroid function, amenorrhea, and decreased bone density. The cardiovascular system is affected by muscle atrophy, leading to weakened heart muscles, arrhythmias, and circulatory collapse. The pathophysiology of anorexia nervosa involves a complex interplay of psychological, neurobiological, and physiological process. Here is a step-by-step breakdown of the pathophysiological process. 1. Psychological trigger. 2. Initial caloric restriction. 3. Hypothalamic pituitary axis disruption. 4. Protein and fat breakdown, catabolism. 5. Organ system effects, cardiovascular system, gastrointestinal system, renal system, endocrine system, bone system, musculoskeletal. 6. Malnutrition and electrolyte imbalance. 7. Neurological changes. 8. Immunosuppression. 9. Advanced starvation and multi-organ failure. Understanding this step-by-step pathophysiology helps highlight the need of early intervention in anorexia nervosa to prevent reversible damage. Signs and symptoms. 1. Physical symptoms: extreme weight loss or failure to gain expected weight. Emaciated appearance, fatigue, dizziness, fainting, dry yellowish skin and hair loss, brittle nails and hair. Amenorrhea in females, cold intolerance due to loss of body fat, fine body hair. 2. Behavioral symptoms: restrictive eating habits, preoccupation with food, dieting and body image, denial of hunger, excessive exercise or ritualistic behaviors surrounding food, social withdrawal and avoidance of eating in public. 3. Cognitive symptoms: distorted body image, seeing oneself as overweight despite being underweight, fear of gaining weight or becoming fat, obsession with food and calorie counting. A diagnosis. A diagnosis is primarily clinical and based on the DSM-5 criteria, which include: 1. Restriction of energy intake relative to requirements leading to significantly lower body weight. 2. Intense fear of gaining weight or becoming fat even though underweight. 3. Disturbance in body image with unique influence of body weight or self evaluation. Additional assessments include: A. Physical examination to assess the degree of malnutrition. B. Laboratory test to check for electrolyte imbalance, anemia and liver kidney function. B. Psychiatric evaluation to assess underlying mental health conditions. Nursing diagnosis: 1. Imbalanced nutrition less than body requirements. 2. Disturbed body image. 3. Anxiety related to fear of gaining weight. 4. Risk for electrolyte imbalance. 5. Risk for injury related to malnutrition. Management. 1. Nutritional rehabilitation, a key component involving structured meal plan to gradually increase caloric intake with close monitoring of weight and vital signs. 2. Psychotherapy, cognitive behavioral therapy (CBT) is the gold standard. Other approaches include family-based therapy (FBT), dialectical behavioral therapy (DBT), and individual counseling to address underlying psychological issues. 3. Medications Although no specific drugs are approved for anorexia nervosa, SSRIs, selective serotonin reuptake inhibitors like fluoxetine may help with comorbid depression and anxiety. A typical antipsychotic such as olanzapine are sometimes used to reduce obsessive thought about weight. For medical stabilization, hospitalization may be required for severe malnutrition, dehydration, electrolyte imbalance, suicidal tendencies, intravenous fluid, electrolyte replacement, and nasogastric feeding may be necessary. Treatment 1. Psychotherapy. The most effective treatment is psychological counseling, including cognitive behavioral therapy (CBT), aimed at changing the person's negative body image and distorted beliefs about food. Family-based therapy (FBT), involving the family in treatment to support recovery. 2. Nutritional rehabilitation, restoring healthy eating patterns and weight. 3. Medications, selective serotonin reuptake inhibitors may help with depression or anxiety, but no medications specifically treat anorexia. 4. Hospitalization. In severe cases, hospitalization may be necessary for medical stabilization, especially if there is extreme malnutrition or life-threatening complications. Psychosocial medicine. One body image therapy helps patients develop a healthier perception of their body. 2. Support groups. Peer support and community therapy can encourage individuals to share their experiences and seek motivation from others with similar conditions. 3. Family involvement. Family therapy is crucial, particularly in adolescence, to improve family dynamics and reduce stress related to eating behavior. Prevention. 1. Awareness campaigns, educating the public about the dangers of eating disorders and promoting body positivity. 2. Healthy coping strategies, teaching stress management techniques such as mindfulness to reduce anxiety and emotional triggers. 4. Early intervention, identifying at-risk individuals, particularly those with family history or early signs of distorted eating, and providing support through counseling. In conclusion, anorexia nervosa is a complex psychiatric disorder with severe physical and psychological consequences. early diagnosis and multidisciplinary approaches involving nutritional, psychological and medical treatment are crucial for recovery. Continuous support, both medically and emotionally, plays a critical role in long-term management and prevention of relapse. Thank you. Have a nice day.